Hello, guys. Let's have a small discussion on a small viral infection which is very common nowadays. A story to begin with. A 4-year-old girl child with a history of nausea, poor appetite from 8 to 10 days. She comes with a fever from 5 to 6 days. That's high grade with chills and rigors. Around 2 to 3 spikes per day. 2 episodes of vomiting on the first day of fever, abdominal distension 4 days, pain in the right upper quadrant, that is right hypochondriac region. Passing high colored urine, yellowish discoloration of the eyes 4 days. What's your diagnosis? Simple diagnosis. Fever means infection, and yellowish discoloration of the eyes denotes that it has jaundice. And since it is a child, you can suspect hepatitis A. That's a very common thing among children. So we deal with a small infection or an infection, hepatitis A. It's a very contagious liver disease. It spreads through fecal-oral contact, that is, with objects that are contaminated with the feces of an infected person. Commonly seen in children under 6 years of age. So it is caused by an RNA virus, a picornavirus. An RNA virus, hepatitis A virus is an RNA virus, and then it is endemic in the blue countries. I mean the blue marked areas in the world map. Commonly seen in Mexico, South America, Africa, the Middle East, the Indian subcontinent, and parts of New Zealand. So it's common. So commonly seen, it's a problem among the travelers, especially to these areas. So commonly occurs because of this low hygiene. So it spreads by fecal-oral route. That is, the virus is reaches the mouth through contaminated foods and water, then mouth to the stomach to liver, where the liver gets infected and symptoms appear. So commonly seen in children, that is below 6 years of age. And then the incubation period is 2 to 6 weeks. As you can see in the figure there, hepatitis A, its transmission is fecal-oral. Incubation period is 2 to 6 weeks. Always tell the range, never tell the correct this one. Always the range is correct, because sometimes it can happen within in 2 weeks, and sometimes it can happen in 6 weeks. On an average it is 4, but still it's better told as 2 to 6 weeks. Whether chronic infection occurs? No. In hepatitis A as well as hepatitis E, both are transmitted fecal-orally, that is from the contaminated food. So this can not lead to chronicity, that is, there is no chronic hepatitis A. If somebody diagnoses it as chronic hepatitis A or chronic hepatitis E, then the diagnosis is considered to be wrong. Whereas hepatitis B, C, D, they are commonly seen as chronic, chronicity. If left, they progress to chronicity. They can go for months to years together, because they are transmitted parenterally. Whereas this fecal-oral, a person will not have a chronic status. Either the person will recover, or if there is any fulminant hepatitis, the patient might die. Very rarely this fulminant hepatitis occurs. So very rarely death occurs because of hepatitis A. But still there is a possibility. But a person might either recover or might die, but will never go for chronicity. That is, it will never become a chronic infection. So what are the symptoms of hepatitis A? They can be fever, malaise, anorexia, that is loss of appetite, nausea, arthralgia, pain in the joints, and jaundice, commonly not seen in children, hepatosplenomegaly, that is enlargement of liver and spleen, and adenopathy. You can see that reduced appetite, jaundice, fever, dark urine or pale poop, nausea and vomiting, pain in the right side of the abdomen where the liver is situated, digestive disorders of diarrhea, joint pain, weakness and fatigue. These are the common symptoms of hepatitis A, non-specific symptoms, but the most specific symptom is yellowish discoloration of the eyes or yellowish urine, yellow urine or pale poop, and pain in the right hypochondriac region or right upper quadrant. So how do we do lab diagnosis? Tests first is either you demonstrate virus in the feces or do a virus isolation, isolate the virus, or detection of antibody by ELISA method, or biochemical tests, AST and ALT, they rise the liver enzymes, they rise within from 22 to 40 days after exposure. And finally, serum bilirubin, serum protein, and RT-PCR. As you know, RT-PCR has been a gold standard in diagnosing COVID. Same, just like that, RT-PCR of feces can be done as a way of molecular diagnosis to confirm hepatitis A. And finally, IgM rises from day 25 and means recent infection. If there is an IgM present, like as you see in the blood report there, IgM, if it is present, it means that it is a recent infection. And IgG is detectable for life. Throughout life, you can find IgG, which is detectable throughout life. And management, no treatment, absolutely no specific treatment. It's supportive treatment, rest according to patient's level of fatigue, hospitalization, vitamin K injections, IV fluid and electrolyte replacement because there will be some digestive disorders, and antiemetic drugs for against vomiting. Then small frequent feedings of high calorie, low fat diet. Proteins are restricted. So because the liver is involved, proteins are restricted. Low fat diet and high calorie diet needs to be given to the patient so that he regains strength, because patients have a high level of fatigue or they feel tired. So it's always supportive treatment. Remember, avoid alcohol, and sometimes interferon alpha can be given if fulminant hepatitis occurs, because fulminant hepatitis occurs very rarely, but if it occurs, interferon alpha can be given. Then an active immunization, as you know, hepatitis A, 2 doses need to be given, 0.5 ml first dose and 1 ml second dose for the kids who are 2 years or above. So, and 6 to 12 months after the first 2 doses. So active immunization, if 1 dose is given, it gives an immunity for at least 1 year. 1 dose, intramuscular dose of vaccine is given, at least 1 year of immunity is provided. Whereas the second dose is, if once the second dose is given, then immunity is lifelong. Immunity is lifelong. So the best way to prevent is use clean water for brushing teeth, wash vegetables with clean water, avoid consumption of raw meat, boil water before drinking, wash hands frequently. So, usually, as I said, prognosis is usually self limiting. Fulminant hepatitis is rare. Chronicity doesn't occur. As I said before, either there is recovery, complete recovery, or can go for fulminant hepatitis and further complications can ensue and death can occur, whereas chronic infection will not occur. There is nothing called chronic hepatitis A. Please remember this, there is no chronic hepatitis A and there is no chronic hepatitis E, whereas chronic hepatitis B exists, C exists and D exists. Thank you.